All right. Cranial nerves. What's a cranial nerve? A cranial nerve is a nerve that comes off of the brain, and we have 12 pairs of them. So cranial nerves are pretty much going to be, and if you recall, right, when we were talking about those different types of neuron chains and whatnot, those pathways and conduction pathways, keep in mind the cranial nerves are not part of the central nervous system. I told you the only things that are part of the central nervous system are the brain and the spinal cord. The cranial nerves are part of the peripheral nervous system, but they just happen to come off the brain. Right? They're similar to spinal nerves, except spinal nerves come off the spinal cord. Right? Cranial nerves come off the brain. Both spinal nerves and cranial nerves are part of the peripheral nervous system. So we do use Roman numerals, right, when we are labeling our cranial nerves. So you should become familiar with the Roman numerals 1 through 12. And I'll go through some of those and try my best to draw them out so you can actually read them. Okay. So, and we'll go through the names, right? And a lot of the times, and this is what I tell folks, we're very fortunate, at least with some of these cranial nerves, the name will tell you what it does. So I will send out some pictures here, very similar to what you're seeing on the screen here. But if you notice, all right, all these cranial nerves are on the inferior view of the brain. And you'll just see them located throughout different areas. For example, cranial nerve number 1 is the olfactory nerve. Right? And you see right up here at the top of the page here, you can see the olfactory nerves. Remember, they're paired, so you're going to have a left and a right one. And then you can see part of the optic nerve here, right? Cranial nerve number 2. And then so forth. We'll get down into the remainder, ocular motor, trigeminal, all those fun ones. All right, so I'm going to work through each one of these individually. So let's start off with the first cranial nerve, the olfactory nerve. Now, something that you should understand, about cranial nerves is that cranial nerves are either going to be sensory, motor, or both. So some cranial nerves are purely sensory, some cranial nerves are purely motor, and some will do both. And so we're going to talk through those. All right, so our olfactory nerve, and how I always remember olfactory is cranial nerve number 1 is I have one nose, and so olfactory is 1, and it has to do with smell. And so it is a sensory only nerve. All right, there's no motor component to it. All right, so all its job is to do is to conduct that sensory information of smell to the brain. And when we get into chapter 16, we'll talk about that and that whole pathway of how you get to the realization of smell here. All right, so that's easy. Olfactory nerve, cranial nerve 1 is smell, and it's sensory only. Cranial nerve number 2 is the optic nerve. Easy way to remember that is you have 2 eyes. So cranial nerve 2 is the optic nerve, and it only has one component, and that's sensory, it's vision. So all that visual information is going to be transmitted to your brain through the optic nerve. There's no motor component for vision through the optic nerve. Okay, so it's just sensory only. So far, so good. Not too difficult. All right, now we're going to get to cranial nerve number 3. If you look at the name, oculomotor, that has to do with muscle movements of the eye. And so ocular motor, cranial nerve number 3, is going to help to do several things. 1, it's going to help to move the eye. It also helps to raise up your upper eyelid there. So if you were to damage this nerve, you would have a drooping of the eyelid. We'll talk about that chapter 15, I believe. All right. We'll also, ocular motor will change the diameter of your pupil, changing how much light enters into your eye, and then also the shape of your lens. So if you need to look at objects that are close by or objects far away, ocular motor will help to change the shape of the lens so you could focus there. So ocular motor is motor only. And so this nerve is going to stimulate 4 muscles in your eye. All right, 4 muscles in your eye. We'll learn those later on, and I'll tell you those muscles when we do chapter 16 labeling. Okay, so not too bad. All right, keeping it kind of simple. Let's talk about the trochlear nerve. Now, the trochlear nerve is another nerve that is associated with the movement of the eye, except in this case, this nerve only controls one muscle, and it's called the superior oblique muscle. So you can see it. I'll zoom in here a little bit. In trochlea, in case you don't know what it means pulley. So here's the superior oblique muscle, and it sits up in the upper corner of your eye close to your nose. But if you notice here, okay, the muscle has a tendon that goes through this little loop here, and that's called the trochlea. It means pulley. And then that tendon takes a sharp turn back because of the trochlea there, and it attaches to the superior lateral portion of your eye. So again, we name this nerve after that structure there, the trochlea, and it only controls one thing, the superior oblique muscle. So trochlea is purely motor. All right, still not too bad. Now we're going to get to something that's going to be a little bit more challenging, and that's cranial nerve number 5, the trigeminal nerve. All right, it is a mixed nerve, and as you know, mixed nerves include both sensory and motor controls. So the sensory portion, real simple. All right, it's going to receive, now this is important, somatic sensation from the face. Okay, somatic sensation from the face. So there's 3 divisions to the trigeminal nerve. All right, you have your maxillary branch, your mandibular branch, and you have the ophthalmic branch. And that has to do with the different parts of where they innervate. I don't think I have a picture on here. No, I don't. So the ophthalmic branch is going to receive all the sensory information from your forehead, all right, and part of your nose here. The maxillary branch is going to receive all the sensory input from the upper portion of your face, like the maxilla. And then our mandibular branch is going to receive all the sensory input from your jaw, your lower jaw, I should say. So that's going to be the somatic sensation. And then the motor part is going to be muscles of mastication. All those muscles that are involved in chewing food are going to be controlled by the trigeminal nerve. All right, so sensory input of the face. All right, now again, somatic sensory is your conscious perception. So if you had your eyes closed, and I've done this to patients before when I'm trying to test the trigeminal nerve, you take a small piece of cotton and I will brush it across their cheek, and then I will ask them what they felt and to point to where they felt it, and then they're telling me that their sensory portion of the trigeminal nerve is working. And I mean, I won't give them food, but if I want to check their muscles of mastication, all I do is ask them to open and close their mouth. Easy enough. There, boom, trigeminal nerve tested. Good. All right, cranial nerve number 6 is abducens. This is another cranial nerve that has to do with the eye movement. And so the abducens controls one muscle of your eye, and that's called the lateral rectus muscle. And so this is the muscle that is going to abduct the eye. What does that mean, Dr. Kaz? That means when your eye looks away from your nose, that is abduction. And that's what abducens means. It means to move away. So it's going to move away from the midline, and your eyes are going to look out towards your ears. Right? And so that's going to be thanks to the abducens nerve, cranial nerve number 6, which only has a motor component, no sensory component. Now we're getting into one of my favorites, the facial nerve, cranial nerve number 7. This is another mixed nerve, right? So it will be involved in both sensory and motor function. Okay, so for the sensory function, it's going to be taste sensations from your tongue. Specifically, you should know this, the anterior 2/3. Anterior 2/3 of the tongue for taste sensation. Okay. Another cranial nerve deals with the other part there of the tongue. Then it also will control the motor component. It will control the muscles of facial expression. And it also plays a role in salivation and tearing and creation of tears for your eye. All right. So it will stimulate the lacrimal gland, which sits in the lateral portion of your eye, of your orbit, and that will create tears. Also, okay, we are going to stimulate, all right, some of your salivary glands, specifically the submandibular and the sublingual salivary glands. So it's this muscle plays a, not muscle, excuse me, this cranial nerve plays a role in digestion. So when we talk about the autonomic nervous system, that's what we're actually referring to here when we're dealing with cranial nerve number 7. It's actually part of your autonomic nervous system, right? Not solely, but it is involved in, there's 4 cranial nerves, and we'll talk about those 4 cranial nerves when we do chapter 15, right, that play a role in the autonomic nervous system. All right, that's cranial nerve number 7. Cranial nerve number 8, purely sensory, right, and we call it the vestibular cochlear nerve. So it plays a role in 2 different sensory functions, the vestibular system and hearing. So hearing and equilibrium, right, that sensory information will travel on the cranial nerve number 8, vestibular cochlear nerve. Cranial nerve number 9, glossopharyngeal. Again, it's another mixed nerve, so we'll have both sensory and motor function. And this one also will play a role in our autonomic nervous system. All right, but for sensation, it is actually going to receive the posterior 1/3 taste sensation of the tongue. And also it will have generalized just touch sensation from the tongue. All right, so your tongue, the anterior 2/3 for taste sensation come from the facial nerve, and the posterior 1/3 for taste sensation comes from the glossopharyngeal nerve. And then cranial nerve 9 plays a role in touch sensation for the tongue. Glossopharyngeal is important for swallowing. So it plays an important role for motor control of the muscles of the pharynx. Those are the muscles of your throat. And I might as well mention it since we'll be talking about it soon enough. When we're dealing with with the autonomic nervous system, all right, the glossopharyngeal nerve is going to stimulate, all right, the parotid gland. It's one of your salivary glands. To produce saliva there. All right, so that's the glossopharyngeal nerve. That's cranial nerve number 9. Then one of my favorites, cranial nerve number 10, is the vagus nerve. This is another mixed nerve. Now, the list of things that the vagus nerve does, it can go on and on and on. All right, but when we're talking about the vagus nerve here, just on a kind of general understanding, it plays a large role in swallowing, so the muscles of the pharynx, and for talking, muscles of the larynx, your voice box. And we receive lots and lots of sensory information from the vagus nerve from many different organs and organ systems. Look down here in this picture and you'll see all those organs there are going to be affected by the vagus nerve. And when you get into next semester in Bio 211, you'll see, you'll go over it a little bit more in specifics. But for example, if you look here, all right, the heart is affected by the vagus nerve. Your heart rate is going to be controlled, not controlled, I should say, but it's going to be affected by the vagus nerve. The vagus nerve will slow your heart rate down. All right. And it plays roles in respiration, digestion, liver function. So it is involved in a lot of those structures, and it plays a role in the autonomic nervous system. So for right now, just kind of memorize, I would say, that the vagus nerve is a mixed nerve, right, that will receive sensory input from several different organs and organ systems, viscera. Muscle-wise, it's going to control muscles of your throat, your pharynx, and your voice box and the larynx. And it will play an important role in the autonomic nervous system, specifically the parasympathetic nervous system. When we're talking about output, that's another name for motor commands. Okay, so motor commands from, all right, your nervous system. And we're dealing with motor commands, all right, we're dealing with autonomic or visceral motor tissue, which will be cardiac muscle, smooth muscle, and glands. So like I said, there's lots that this vagus nerve is involved in. And I always tell folks, if you're taking a test and you're reading a question and you just have no idea, all right, what the answer is, but you see vagus nerve as one of the answer choices, you might as well mark it because it does so much. All right, our next cranial nerve is the accessory nerve, cranial nerve number 11. Another motor nerve, and it's going to control, all right, the muscles of your neck and pharynx. Now, not all of them, right? It's going to control the sternocleidomastoid muscle, the trapezius muscle, or just a couple, but those again are both in the neck and in the back. All right, so the accessory nerve. Now, sometimes I should say this: the accessory nerve is also referred to as the spinal accessory nerve. So if you're reading that and you're like, spinal accessory nerve, what the heck is that? It's the same thing. Okay, it's the same thing. And cranial nerve number 11 also, right, will help out cranial nerve 10 with some of the pharyngeal muscles. All right, the last one, easy, the hypoglossal nerve, cranial nerve number 12. This nerve, right, will control muscles of the tongue. All right, there are several different tongue muscles, but for right now, all right, all you need to know is hypoglossal is going to control the muscles of your tongue. And it's real, and it's interesting with the hypoglossal nerve, because if you want to see, remember what I said, right, cranial nerves are paired nerves. So your right cranial nerve is going to innervate the muscles on the right side of your tongue. Your left hypoglossal nerve is going to innervate the muscles on the left side of your tongue. So what will happen is, we joke around about it, is that when you injure this cranial nerve, your tongue points to the side that the injury is on, because the muscles that aren't affected will push the tongue to the opposite side. So, for example, if I injure my right hypoglossal nerve, okay, that means the muscles on the right won't work, but the muscles on the left will. So if I say to you, okay, stick out your tongue, and since the muscles on the right aren't working, the muscles on the left overpower, and it will push your tongue to the weak side, to the right side. So your tongue literally points to the side that the hypoglossal nerve is injured on. So it makes it nice and easy for us. Okay, that's all of the cranial nerves. So let's just go in and do some labeling, and then we'll be done for the evening. All right. Where are we? Here we go. All right, so if you have your atlas close by, please pull it out. It would be nice to do so. We just have to finish up, right, with our dural venous sinuses and our ventricles in the brain. So let's start off. Remember what these structures are, these dural septa. All right, the dural septa is the dura mater, which is the outer layer of your cranial meninges. It's made up of dense irregular connective tissue. And so normally the dural septa is two layers fused together. And so that's what we're seeing here. The falx cerebri is that sheet that sits in the longitudinal fissure that separates the right and left cerebral hemispheres. So there's the falx cerebri. Here you can see it in this model very nicely. And so that sits in between the right and left cerebral hemispheres. And yes, it helps to separate them, but it also helps to support the brain. So now we've taken the brain out of the skull and we're looking down superiorly down into the cranial cavity here. And you'll see there's this little structure. This is another dural septa here. And it's going to be separating the left and right cerebellar hemispheres. So we call it the falx cerebelli. Here you can see on this model the tentorium cerebelli. Tentorium cerebelli separates the temporal and occipital lobes of the cerebrum from the cerebellum. So I think of it as a tent flap, and it sits right over the cerebellum. Here you can see it in that model. All right, tentorium cerebelli. You can see in that little space over here, that's the cerebellum will be sitting right underneath that. And then over here, the temporal lobe and the occipital lobe will be sitting on top of the tentorium cerebelli. Now, of course, the dural septa, again, it's two fused layers of dura mater. Well, where they pull apart from one another, they create a space. And so we have venous blood that drains from the brain that fills that space. So we call the space a sinus. Well, this is the superior sagittal sinus. You can see it sits along the superior margin here in the sagittal plane, okay, at the top of the skull here. That's the superior sagittal sinus. And then you can see below it a smaller sinus, right? All of this, that's the inferior sagittal sinus. Then you'll notice the inferior sagittal sinus will dump into this sinus here. It's called the straight sinus, and that runs along the tentorium cerebelli and along the falx cerebri posteriorly back towards the posterior part of the skull there. Tough to see it on this angle here, all right, or this view here, the transverse sinus, that sits on the edge, the margin there of the tentorium cerebelli. I'll show it to you from a different angle here. Here you can see the transverse sinus along the side here. Here's the transverse sinus. And then your superior sagittal sinus, you can see how it's coming down here on the posterior aspect of the skull there. So the superior sagittal sinus runs from the posterior aspect up along the top of the skull all the way to the front here. All right, so this arrow is indicating is pointing to the longitudinal fissure, but that's where you're going to see that falx cerebri sitting in. So that falx cerebri sits in the longitudinal fissure, and then the tentorium cerebelli is going to fit here into the transverse sinus here. Not sinus, excuse me. Where is my thingy? There it is. You can see it's going to sit right here. Okay, so you're probably thinking, what the heck am I looking at, Dr. Kaz? What you're looking at here is a model to the ventricular system of your brain. So what has been done is we've taken a mold of all those spaces in your brain and we've peeled the brain off of those spaces. So this is actually what the ventricular system looks like in your brain. And so we are looking, okay, the view that we're looking at is this as if you and I were standing face to face. So our right side of the screen is the anatomical left for this model. So you're seeing the left lateral ventricle, and that's that big C-shaped region here. Here, and then you can see the right lateral ventricle all the way over there. All right, so there's the right lateral ventricle on the left side of our screen. Here now, it's anatomically correct. Now it's as if I was standing behind you at the bank, okay? So the arrow is pointing to the right lateral ventricle, and then you can see, all right, how the lateral ventricles connect to the third ventricle through these structures right here. That is called the interventricular foramina, or the foramen of Monroe. That's where cerebral spinal fluid drains from the lateral ventricles down into the third ventricle. Right here, you can see it from a lateral view. That's the interventricular foramina. And then here's our left lateral ventricle. Again, this is anatomical. And here's the third ventricle. So your right and left lateral ventricles will drain into the third ventricle. So keep in mind, the third ventricle sits at the center of the diencephalon. Pretty much all those structures that we learned that are part of the diencephalon surround the third ventricle. Okay, so here you can see the third ventricle below, inferior to parts of the lateral ventricles. And then our third ventricle will drain into the fourth ventricle that's found down in the brainstem, right by the pons, in front of or anterior to the cerebellum. Here you can kind of see it a little bit on the lateral view here. All right, here you can see it from this view. So again, the fourth ventricle is going to be inferior to the third ventricle. And the structure that connects the third ventricle to the fourth ventricle is the cerebral aqueduct. We saw part of that cerebral aqueduct, right, when we were looking at the midbrain there. We saw that hole there in the midbrain. And that hole was the cerebral aqueduct. Here you can see it on this model here, the cerebral aqueduct. And then one more time from the lateral view there. So again, the third ventricle drains into the fourth ventricle via the cerebral aqueduct. So now, using that brain model that's in our atlas, you can see right now we're in the midbrain there. That's where the cerebral aqueduct is located. All right. Here again, where that arrow is indicating is the area of the third ventricle. Keep in mind, the structures of the diencephalon are going to be surrounding the third ventricle. So when you're taking your test, make sure that you're reading those slides very closely, because if it's pointing to the area that that arrow is pointing to, or even here, all right, that structure is the hypothalamus. But if there's some words on the slide and it says name the space or name the area that the arrow is pointing to, then you would say the third ventricle. And there you can see the fourth ventricle right there, anterior to the cerebellum, posterior to the pons. All right, folks, that concludes this evening's slideshow for